COB is something that I'm sure you know about in medical billing if you have been doing it for any amount of time. Now, if you're new, you probably don't know what it is, and I'm pretty sure you're going to have to deal with it at some point in your career. So today I'm going to be discussing COB. So if you don't know what COB is, or you want to learn a little bit more about it, then make sure you keep watching this video. My name is Tamika. I'm a certified professional biller and a certified professional practice manager. So we're going to be discussing COB, and if you don't know what COB is, it is coordination of benefits. And coordination of benefits is, and it's according to the National Association of Insurance Commissioners, it establishes an order in which plans pay their claims and permits secondary plans to reduce their benefits so that the combined benefits of all plans do not exceed total allowable expenses. So in layman's terms, it's when a patient comes in and they have more than one insurance. And you have to figure out which insurance pays primary and which insurance pays secondary. Also, the insurances don't pay above the allowable of the primary. So, for example, if you have a charge that is $100 and that's the allowable. So let me make that clear, because you can bill anything, but as far as what's allowable, that's a different story. So if the allowable is $100, you send that out to the primary and the primary pays $80. And then you send it out to the secondary. The secondary should not then pay you $50 because let's say their allowable is $150. They will not pay you $50. They will just pay you the difference between the $100, which is the allowable of the primary, and the amount that was paid, which was $80, and that is $20. So I hope that is clear, but this is what coordination of benefits is. Now, again, you might have dealt with it and just really don't understand what it is, but that's what it is. And I kept saying COB because we tend to use abbreviations and acronyms and all those things in medical billing, but make sure that you do understand what these terms mean in its entirety. So who determines coordination of benefits, you might ask? And as I go on, I'm not going to keep saying coordination of benefits. I'll say COB. So you should know by now what it means. Who determines COB? Now, the patient doesn't determine it, nor do the insurance plans. COB is determined by these rules and regulations that I am going to tell you later on in this video. So make sure you stay tuned to that. But sometimes a patient may come in and they may want to decide who is primary and who is secondary, and they're not the ones to do that. So you have to be able to explain to them why they're not the ones to do it and who is the one to do that. Now, what does COB have to do with medical billing? As a medical biller, you are going to see situations where you may get denials because of COB. And you are not the one who initially deal with the insurances, or I may say you may not be the one, because depending on what you do, what your duties are, you might be doing everything from front desk beyond. It just depends. But normally a medical biller doesn't deal with collecting the insurance information. So you may not be the one who deals with it initially, but if it's not done correctly, then you will be the one who have to deal with it. So that is why we as billers need to know what COB is. So what denial code would you see if you get a denial for COB, and how do you deal with it? The denial code that you will see is CO22, and that is contractual obligation. And the description for it can be worded in any way, but basically it means that there was a payment adjustment because the care may be covered by another payer. Again, it may not say exactly that, but that's what it means. Now, how do you deal with that? I can't just answer that in one thing, because depending on the coordination of benefits for that patient will decide how you actually deal with it and what you have to do. So we'll get into that later on. Keep watching to see what it is. So who else should know about COB? Besides the medical biller, the front desk needs to know about COB and the patient needs to know about COB. So like I was saying earlier, the front desk is usually who deals with coordination of benefits and not actually like deciding who's primary, who's secondary, but they should know how to decide it and put it in the system so that when you send out the claims, you'll be sending it out to the right payer. So they should know the rules and regulations of COB. Then the patient should also know. And not only should they know the COB for themselves, but they also should know that they need to let us know about COB. Because there are a lot of times that patients come into the office, they're filling out registration forms, they're filling out, updates for the registrations, and they will not put that they have 2 insurances or 3 insurances or how many ever insurances that they have. If they decide that one insurance is better than the other and they just don't feel like using that other insurance, they just won't put it. And sometimes we wouldn't know that they even have more than one insurance. I know that there have been patients that came to my office and they have a Cigna insurance. And Cigna here in the U.S. Virgin Islands is a good insurance, especially Cigna government. And so they might have something else like Aetna or whatever, but they have Cigna government under their spouse and they're like, I have Cigna. So we as the office or as a staff, we need to check and make sure. So when we check that and we see, oh, this patient has it under their spouse, it's some payers will actually show us, well, is there COB, is there not? And sometimes there is, and they show us that, and then we will have to ask the patient, do they have another insurance? Or sometimes Cigna doesn't even know about the other insurance, so they think they're actually primary. And that's a whole nother video in itself. But patients should also know so that when they go to the doctor, they can know that they need to tell the doctor about their insurances and which one should be first and which one should be second. Even though we should then in turn validate that and make sure that it's correct, but they should at least know to tell us and put it down on the registration form. So there are different types of COB. I'm going to go through 6 of them. So I'm trying to make this as clear and concise and quick as possible. So if you need me to go deeper into any of them, I can probably do another video on it, but I don't want to make this video too long. So we're going to go quickly through the 6 types of COB that there can be. Now, this was taken from the Coordination of Benefits Model Regulation. It was dated October of 2013. And this is on the website for the National Association of Insurance Commissioners. This is section 6D. And so if you want to then go and look at it, you probably should. And because it goes into further detail and gives you examples and all of those things. So if you want to look into it, I will leave a link so that you can actually, view it for yourselves. I always recommend you do that. And this is the Order of Benefits Determination section. So the first one is non-dependent or dependent. And this is for when the patient is 26 years of age or older. Now, if they have 2 plans and on one of them, they're the subscriber or the employee and the other one, they're dependent, the one that they are the subscriber or the employee is primary, the one that they're a dependent is secondary. Then we have MAP or Medicaid. Now, I don't even know if you guys call it MAP, but here in the Virgin Islands, we call Medicaid MAP. And if you have Medicaid, Medicaid is always secondary. And that doesn't matter to what insurance. As long as they have something other than Medicaid, that something is primary, whether they are the dependent or they are the employee or the non-dependent. Then we have Medicare. And Medicare kind of goes into a lot of different coordination of benefits, and I'm not going to go through all of them right now. But for the most part, if there's a other plan and Medicare, then the other plan is primary, Medicare is secondary. And that's if the other plan, the patient is a dependent. If they are not a dependent, they're the employee, and then they have another plan that they're also like not a dependent, then the Medicare is primary and the other plan is secondary. Again, before you come for me in the comments, there's a lot more when it comes to Medicare. So that's just a general overview, but there is other ones that I can actually go through and do a video because they'll take us just as long as this video that I'm doing now. Now, the second one is for a dependent child. Now, if the parents are married or living together, because they don't have to be married, then we're going to use the birthday rule. And the birthday rule is whichever parent's birth date is earlier in the year is who is primary. So when we say the birth date, it's not the complete birth date. It's just the month and the year. So if my birthday is in June, my husband's birthday is in April, then my child's insurance is going to first go under my husband because his birthday is in April, and then mine because my birthday is in June. If we have the same birthdays of June, then we're going to go by whose plan was the longest. So if I had my plan for 6 years and he had his only for 2 years, then mine would be primary. Then we have if the parents are divorced or separated. And this is going to be if there's no court decree. I've been trying to get that word for the longest. Finally got it. But if there's no court decree, then there's nothing that's actually telling you how things are supposed to go. And if that's the case, then the custodial parent will be primary and the non-custodial parent will be secondary. Custodial meaning that the child lives with, has the majority of time with that parent, and non-custodial meaning that they don't have the majority of time with that parent. Then we have when a dependent child has coverage under their parents, whether it's one or both parent, and then also has insurance under their spouse. So that makes the patient at least, over 18, I guess, enough to get married. So if that's the case, then the rule we're going to go by is the longest coverage rule, meaning out of all 3 people or 2 people, meaning one of the parents and the spouse, whoever had the insurance longest is who is going to be primary. If there's 3 of them, then we'll do the same thing. Now, if the date of coverage was the same for both or for all 3, then we'll go by the birthday rule. The third one is active employee or retired. So if a patient has 2 plans, one they are the active employee of, they're still working. The other one they're retired, but they still have that plan. Then the active coverage is going to be primary and the retired coverage is going to be secondary. The fourth one is COBRA. And COBRA stands for Consolidated Omnibus Budget Reconciliation Act of 1989. And you can get COBRA when you leave a job and you were, let's say, fired, or you quit, or you were laid off, but you still wanted to continue coverage. So that's how you can actually get COBRA. But if you have COBRA and you also have another plan, let's say that you got a job and you have 2 insurances, then that new job would be your primary and then the COBRA would be your secondary. And then we have number 5. Number 5 only applies if 1 through 4 doesn't apply. So this is the longer or shorter coverage rule. And if you have 2 plans, you will determine who's primary by the one you were covered by longest. And this doesn't matter whether you are dependent or a non-dependent. Now, what determines longer is, of course, how long you had that plan. But sometimes you change insurance and you may think that that will cut off that time that you have. But if you have 2 consecutive plans that change over within 24 hours, like one ends and one begins within 24 hours, they consider that as being one. So for example, if I had Cigna insurance, and I had it for a year, and then my employer changed over to United Healthcare. Now there are two payers, but it changed over within 24 hours. So the Cigna ended on May 31st, and then the United Healthcare began on June 1st. They would consider that as one, and then they would combine the length. So if I had Cigna for 1 year and United Healthcare for 1 year, then they would consider that 2 years. And if I had another plan, then that plan was only 6 months. Then those two plans, which will equal to one, would be my primary, and then the 6-month plan would be the secondary. I'm actually dealing with something like that right now with one of the patients in the office, because both insurances did not want to cover her. And I had to try and fight this because I know she's paying for both coverage, but one is saying, no, we're not primary. The other one is saying, no, we're not primary, and nobody's paying. So I had to try and figure out, well, what's going on? And I actually determined that it is this longer, shorter coverage rule, because she switched insurances within a time span, but it was still under her same employer, and it was within 24 hours. So that plan is the longest and should be considered primary, and then her other plan should be considered secondary. So we're trying to get that fixed now, but sometimes these things do come up and you have to try and figure out which one is which. And now the last one, which for me is new, but the last one is that if none of these apply, if nothing from 1 through 5 applies, then the expenses are split in half or equally. And that one was new for me because I'm saying to myself, different insurances have different fee schedules. So how would you know which fee schedule to use? Or maybe you would just use the higher fee schedule so that you can make sure that you get the highest amount of money. I don't know, but this one is new for me, but this one was also one. So I just wanted to do this COB video just for you to get an overview of what it is, because you will definitely have to use it within your career as a medical biller. Again, please look in the link below so that you can go through it yourself, read through it, read the examples, because maybe some of this might not have been clear. And if it hasn't and you have any questions, please leave that below. I hope it clarified a little bit what COB is if you didn't know, or if you had additional questions. And I will see you again in my next video.